Ladies and gentlemen, my name is Vera Alberta, and today on Raw and Uncut, we look at a topic that not many want us to discuss: decriminalizing suicide. Section 226 of Kenya's Penal Code stipulates that any person attempting to take their own life is guilty of a misdemeanor, and you could be imprisoned for up to 2 years or a fine or both. Minimum age of prosecution, 8 years.
20 is the estimated number of countries that to date still criminalized attempted suicide.
Suicide in many parts of the world is treated as a criminal act.
Probably what you don't want to hear, right? Cases of suicide have been witnessed in various parts of the world, Kenya included. But before you judge anyone contemplating suicide, know that it should not be taken lightly because
it is the result of untreated mental illness. As a society, we must shift our perspective and treat it as a public health issue, not a matter of law enforcement.
Mental disorders provide for a bulk of disease burden, with Kenya having a good number of people seeking help. As of 2022, according to the Kenya National Commission of Human Rights, an estimated 25% and 40% outpatients and inpatients suffer from mental health conditions, the most frequented being depression, substance abuse, stress, and anxiety disorders.
Evidence shows a staggering 42% of individuals seeking care in primary healthcare facilities have symptoms of severe depression, with an estimated national prevalence of common mental disorders such as depression and anxiety at about 10.3%.
10th September 2024, a task force that was launched to issue the first clinical guidelines for the management of common mental disorders had some recommendations.
We cannot afford to ignore the mental health needs of any segment of our population. It is my brief that mental health should not be a medical issue, but a social and legislative priority.
Further widens the treatment gap for mental disorders, which is estimated by the Task Force on Mental Health to be about 75%. To address this issue, the task force recommended capacity building initiatives for healthcare workers to improve the availability of mental health service across the country.
Now, even as recommendations are being made, it is important to know that the gap in the health sector needs to be filled, with deploying of mental health workers being mentioned to aid in dealing with the mental health disorders across the country.
The fact that the government has worked very hard to improve the number of health workers in the country, but still the gap in terms of the health workforce is quite big, and indeed there are several counties in the country without a single mental health worker.
A critical group that has not been left out in the sensitization has to be the armed forces.
We passed a motion to provide mental health support services to officers. We must ensure that those who protect us are also protected from the invisible scars of mental illness.
And while it is important to note that suicidal cases are discouraged, it is also important to note that people will seek help only and when they feel it is safe to speak or express themselves. Decriminalizing suicide is never a solution.
These are lives we could save if we create an environment where people feel safe to seek help. As we launch these clinical guidelines, we are taking a monumental step toward improving mental health care in our country. But let us not stop here. Let us also advocate for policies that remove the barriers to mental health services.
It is the responsibility of the government to ensure its people are able to access quality healthcare, and this is not just any healthcare. Thus, the budgetary allocation should be enough to cater for mental health.
Look at the total health budget, both in private and in public, the amount of finances that go to mental health care is dismal. This leads to serious gaps in terms of the health workforce and access.
And as the world commemorates Suicide Prevention Day, it is important to raise awareness about reducing stigma and encouraging open conversations to prevent suicide. This year's theme, Changing the Narrative on Suicide.
Half of the population will experience mental health illness at some point in our lives. That is a big number, and actually mental health illness is a leading cause of disability in our lives. 40%. And we know that people with mental health illness, especially the ones with severe mental health illness, have a 40% higher risk of other physical conditions such as cardiovascular diseases and metabolic complications.
My name is Vera Alberta, and this is Raw and Uncut.